Good morning, Jacqueline, and thank you for presenting at our committee. And what you've given is a very comprehensive report on what you are doing in the Scottish Parliament. I think you're a long way ahead of us here in Ireland, and I think there's no point in reinventing the wheel. And if we can replicate some of the things that you're doing to improve services for autistic people, that's what we should be doing. I suppose one of the issues of concern in Ireland at the moment is the lack of assessments and services for children who have autism or suspected to have autism. We currently have 17,000 roughly children on a waiting list to receive an assessment, and then many more even who have received assessments are waiting for services such as speech and language therapy, occupational therapy, physiotherapy, psychology and so on. A progressive disability model was introduced in 2021, which established 91 children's disability network teams throughout the country, but none of these teams are fully staffed, because basically the workforce planning wasn't done, and there's an acute shortage of those professionals across those teams and across many other sectors that use those professions as well. So I'm just wondering how that compares with yourselves in Scotland, and have you similar problems, or have you a different method of dealing with assessment and services? Because it links into education as well, because in school, while a large number of probably the majority of autistic children attend mainstream school, some will attend an autism class attached to a mainstream school where there will be integration between mainstream and the class, which is the ideal model, and then some will attend special schools. But we need to ensure going forward that our education is inclusive. So it's again, what example you have in Scotland as well. And I suppose you've identified a lot of cooperation across departments, and I think that's something that we need to replicate here, because often we find departments working in silos when they should be working together, because often services overlap several departments. I suppose the other question I would have is, being conscious of time, adult diagnosis as well is something that's not available on as a on the public pathway. You can privately access a diagnosis or an assessment. So I'm just wondering if that's an issue, and then obviously follow-up services to that assessment as well. Thank you.
Thanks. So a huge amount in there, so I'll try to answer your key points. There were some significant issues around mental health support in Scotland. So pre-COVID, there was work being done around the fact that what was referred to as rejected referrals. So there were a lot of children and young people who were not getting access to mainstream mental health services. And there were a number of changes that came out of that work. And one was that the recognition that for some of those children, so this is in the broader mental health context first, for some of those children, it really wasn't appropriate for them to be being referred into what we would call CAMS in Scotland, children and adolescent mental health services, because they weren't meeting the criteria for that. But there were lots of other lower level things going on, what you might call lower level, but obviously serious for individuals' anxiety, things that wouldn't merit the CAMS support. So as a result of that, there's been a significant amount of money invested in Scotland in community mental health supports. So that is now away, and that's now being replicated for adults as well. So that's really important to sit alongside the more formal mental health support routes, because obviously that can affect autistic people, for example, in terms of anxieties. So it's project-based in the community, lots of local projects and people able to access that support, and it's self-referred. So there's no requirement to go through a process. And then also, as a result of that original work, and it was a lady called Denise Toya who produced the original report, we've worked in Scotland on support for children and young people. And we published in September 2021 a national neurodevelopmental specification for children and young people. So there's a link to that in the briefing that you've got. And that's really critical, because that set out the sort of aspirational standards for service providers. And it's focused around neurodevelopmental support in that broader sense. So the idea there, as we're now piloting for adults, is that you don't try to put somebody down a narrow path. You have a learning disability, this is a pathway that you will follow to get support. It's about a broader approach, recognising that somebody who is in need of neurodevelopmental support is likely to have a number of different things going on. They could have a learning disability and be autistic, they could have ADHD, there could be a number of things going on. So that specification, published in autumn 2021, has already set out those standards for our local service providers for children. Now that went hand in hand with an injection of funding, so more than 3 million was provided to our local NHS boards to build capacity to allow people to implement these standards and to support professional development. That's probably, we can provide you more information about that, but that's critical in terms of the new approach and how we're intending to bolster that support for children and young people. There are issues around workforce shortages. I'll talk a bit about that in the context of adults. But to answer your points around education, we can provide you more information on that. I mean, in Scotland, again, there's a fairly long history to the educational side of things. We had, I would say, families and parents were probably experiencing similar issues to the ones that you may be experiencing in Ireland around, particularly if autistic young people in mainstream schools struggling to attend, struggling to access support in a mainstream school. So there was a big report, a really critical report that came out a few years ago called Not Included, Not Engaged, Not Involved, and that really reset the relationship around schools. There was a huge amount of work that came out of that, and that was looking at use in schools of restrictions on behaviour, restraint in general, and just the inclusion of autistic young people in the school community. So there was a whole load of work done around education. There's an approach in Scotland called Getting It Right for Every Child. So the approach is that GIRFEC applies, as we call it, in schools. So if you have in a school setting children with additional needs, they should be receiving that additional support through mainstream schools. There can be issues around how that is rolled out in practice, but that's certainly the backdrop. I would say probably in relation to, I've touched on it already, but in relation to adults, we will be in a not dissimilar position to the one that you've perhaps started to describe for Ireland. So around autism in particular, I think that what we're seeing now is a whole cohort of adults who are kind of realising that they may have struggled for a very long time with some issues around, how they engage socially or different things that are going on for them, and are sort of coming to their own conclusions that they might be autistic. And as we know more about autism, and that this seems to come to the fore in Scotland as well, and we are seeing a huge pressure on services from adults coming forward and looking for assessment, support and/or diagnosis formally. And we don't currently have the services in most places to support those adults, because services were built up around children and young people. So what has tended to happen is that in some areas of the country, and we have obviously local authorities in Scotland, and we have health and social care partnerships and NHS boards. So in some areas, there may be support available for adults. In other areas, there won't be. And sometimes support is available for ADHD, sometimes for autism, very rarely for both together in one pathway. And where support's being provided, it tends to be from staff who are being borrowed from the Children and Young People Service to provide that support. So this is a fairly well-known and certainly public issue in Scotland through some of the work that we've done. So I think there's a link to it in your documents as well, but there was a key report that came out in February on adult neurodevelopmental pathways that I would encourage you to have a look at. So that basically summarises the pilot work that we've done in Scotland for adults in recognition of the position where adults were not able to easily access support. And it has a range of about 10 recommendations in there, which will characterise our next stages of this work, which ministers have signed off on, obviously, and we are now setting ourselves up to carry forward. So that's critical in the sense that there's recognition of the gap in service and support. There's recognition that for adults, it's a slightly different position we find to children and young people, particularly around diagnosis. So whilst we would always build our systems around access to support and assessment, with formal diagnosis not necessarily being part of that, we are also recognising for adults that many adults do tell us that actually diagnosis can be quite critical for them, because sometimes the support that adults require may be quite low, but what they do want is to have that formal diagnosis for a number of reasons. So there's recognition of that, and really just a sort of a bit of a few steps set out in that report which will guide us on our way forward. Essentially at the moment we've looked at joining autism and ADHD pathways together for a single pathway, but certainly with the longer term aim that as for children and young people would be a single neurodevelopmental pathway, so that you have one door, you have one route of access, and it's centred around you as an individual. Thank you.